Welcome to Part 10 of our 862-question NCLEX-RN 2026 practice series. In this video, you'll complete questions 651 to 750, featuring NCLEX-style practice questions with detailed explanations to strengthen your clinical judgment, nursing knowledge, and exam confidence. Books like, subscribe, and turn on notifications to follow the complete 862-question NCLEX-RN 2026 series and keep preparing for NCLEX-RN success. Question 651. Due to his prolonged history of alcohol abuse, an alcoholic client will most likely have deficiencies of which of the following nutrients? A. Vitamin C and zinc. B. Folic acid and niacin. C. Vitamin A and biotin. D. Thiamine and pyroxidine. Answer: D. Thiamine and pyroxidine. Explanation: A. Chronic alcoholism can lead to deficiencies of B-complex vitamins including thiamine and pyroxidine. B. Chronic alcoholism can lead to deficiencies of vitamins A, D, K, and B-complex. C. Chronic alcoholism can lead to deficiencies of vitamins A, D, K, and B-complex. D. Vitamins A, D, K, and B require bile salts to be absorbed from the gastrointestinal tract. A damaged liver does not form bile salts. Question 652. A 26-year-old male client is brought by his wife to the emergency department, ED, unconscious. Blood is drawn for a stat blood count, CBC, fasting blood sugar level, and electrolytes. An indwelling urinary catheter is inserted. He has a history of type 1 diabetes, insulin-dependent diabetes mellitus, IDDM. A diagnosis of ketoacidosis is made. Stat lab values reveal a blood sugar level of 520 mg per deciliter. Which of the following should the nurse expect to administer in the ER? A. D50W/4 push. B. NPH insulin SC. C. Regular insulin by 4 infusion. D. Sweetened grape juice by mouth. Answer: C. Regular insulin by 4 infusion. Explanation: A. This action would further increase the client's blood sugar. B. NPH insulin is an intermediate-acting insulin, with an average of 46 hours before onset of action. The client needs insulin that will act immediately. During a ketoacidotic state, the client is dehydrated, so any insulin administered SC will be poorly absorbed. C. Regular insulin is the fastest-acting insulin. When given 4, it will immediately act to decrease blood sugar. Regular insulin is given to decrease blood glucose levels by promoting metabolism of glucose, inhibiting lipolysis and formation of ketone bodies. D. This action would further increase the client's blood sugar. Question 653. Blood work reveals the following lab values for a client who has been diagnosed with anorexia nervosa: hemoglobin 9.6g/dl, hematocrit 27%, potassium 2.7 milliequivalent/L, sodium 126 milliequivalent/L. The greatest danger to her at this time is: A. Hypoglycemia from low carbohydrate intake. B. Possible cardiac dysrhythmia secondary to hypokalemia. C. Dehydration from vomiting. D. Anoxia secondary to anemia. Answer: B. Possible cardiac dysrhythmia secondary to hypokalemia. Explanation: A. There is no lab data to support hypoglycemia. B. Hypokalemia, caused by vomiting and decreased dietary intake of potassium, can result in life-threatening dysrhythmias. C. Evidence of dehydration is not life-threatening at this time, although fluid volume deficit does need to be addressed. D. The client's hemoglobin does not reflect a life-threatening value sufficient to render the client anoxic. Question 654. On the third postpartum day, a client complains of extremely tender breasts. On palpation, the nurse notes a very firm, shiny appearance to the breasts and some milk leakage. She is bottle feeding. The nurse should initially recommend to her to A. Take 2 ibuprofen, Motrin, tablets by mouth now because the baby will be returning for feeding in 20 minutes. B. Allow the infant to breastfeed at the next feeding time to empty the breasts. C. Apply ice packs to the breasts and wear a supportive, well-fitting bra. D. Take a warm shower and express milk from both breasts until empty. Answer: C. Apply ice packs to the breasts and wear a supportive, well-fitting bra. Explanation: A. Judicious use of analgesics is appropriate with breast engorgement, however, mechanical suppression would be the initial recommendation. B. Breastfeeding every 1,123 hours will reduce and/or prevent breast engorgement. Breastfeeding will promote milk production, which will compound the distension and stasis of the venous circulation of engorgement in a bottle-feeding mother. C. Ice packs reduce milk flow while the snug, supportive bra provides mechanical suppression and decreases pulling on Cooper's ligament. In addition, breast binders or ACE bandages may be used for some women. D. Warmth promotes milk production and may stimulate the letdown reflex. These measures would contribute to the venous congestion of engorgement. Question 655. The doctor has ordered a restricted fluid intake for a 2-year-old child with a head injury. Normal fluid intake for a child of 2 years is A. 900 milliliters per 24 hours. B. 1,300 milliliters per 24 hours. C. 1,600 milliliters per 24 hours. D. 2,000 milliliters per 24 hours. Answer: C. 1,600 milliliters per 24 hours. Explanation: A, B, D, these values are incorrect. Normal intake for a child of 2 years is about 1,600 milliliters in 24 hours. C, this value is correct. Normal intake for a child of 2 years is about 1,600 milliliters in 24 hours. Question 656. A client is placed in 5-point restraints after exhibiting sudden violence after illegal drug use, and haloperidol, Haldol, 5 mg IM is administered. After 1 hour, his behavior is more subdued, but he tells the nurse, "The devil followed me into this room, I see him standing in the corner with a big knife. When you leave the room, he's going to cut out my heart." The nurse's best response is A. I know you're feeling frightened right now, but I want you to know that I don't see anyone in the corner. B. You'll probably see strange things for a while until the PCP wears off. C. Try to sleep. When you wake up, the devil will be gone. D. You're probably feeling guilty because you used illegal drugs tonight. Answer: A. I know you're feeling frightened right now, but I want you to know that I don't see anyone in the corner. Explanation: A. The nurse is the client's link to reality. This response validates the authenticity of the client's experience by casting doubt on his belief and reinforcing reality. B. Although this statement may be literally correct, it is non-therapeutic because it lacks validation. C. This response encourages the client to attempt to do something that may be impossible at this time, offers false reassurance, and reinforces delusional content. D. The nurse is making an incorrect assumption about the client's feelings by offering a non-therapeutic interpretation of the motivation for the client's actions. Question 657. When assessing the client 6 hours postpartum, the fundus is found to be U+3, displaced to the right of midline, and slightly boggy. The nurse would first A. Increase the 4-oxytocin drip rate. B. Give Methergine IM. C. Assess for a full bladder. D. Grasp the uterus and massage vigorously. Answer: A. Increase the 4-oxytocin drip rate. Explanation: A. Oxytocin may not be necessary if the bladder is emptied and if the uterus remains firm, midline, and at about U11 after massage. B. The same rationale as for Answer A applies. C. A full bladder is the most common cause of uterine atony. If the bladder is full, it should be emptied and the uterus reassessed before further intervention. D. If the bladder is full, the uterus will not stay contracted or return to a normal position. Overly vigorous massage also encourages uterine atony. Question 658. A registered nurse is trying to determine the appropriate care that she should provide for her obstetrical clients. Which of the following documents is considered the legal standard of practice? A. State Nursing Practice Act. B. AWAN Standards for the Nursing Care of Women and Newborns. C. American Nurses Association Standards of Maternal Child Health Nursing. D. International Council of Nurses Code. Answer: A. State Nursing Practice Act. Explanation: A. The State Nursing Practice Act determines the standard of care for the professional nurse. B. AWAN standards are published as recommendations and guidelines for maternal newborn nursing. C. American Nurses Association standards are published as recommendations and guidelines for maternal child health nursing. D. The International Council of Nurses Code emphasizes the nurse's obligations to the client rather than to the physician. It is published as recommendations and guidelines by the International Organization for Professional Nursing. Question 659. A 6-year-old girl is visiting the outpatient clinic because she has a fever and a rash. The doctor diagnoses chickenpox. Her mother asks the nurse how many baby aspirins her daughter can have for fever. The nurse should: A. Advise the mother not to give her aspirin. B. Ask if the client is allergic to aspirin before giving further information. C. Assess the function of the client's cranial nerve 8. D. Check the aspirin bottle label to determine milligrams per tablet. Answer: A. Advise the mother not to give her aspirin. Explanation: A. Aspirin taken during a viral infection has been implicated as a predisposing factor to Reyes syndrome in children and adolescents. Children and adolescents should not be given aspirin. B. Allergy to aspirin is not related to Reyes syndrome. C. Tinnitus, caused by damage to the acoustic nerve, occurs with aspirin toxicity, but this is not related to Reyes syndrome. D. A 6-year-old child should not be given any baby aspirin. Question 660. On admission to the postpartum unit, the nurse's assessment identifies the client's fundus to be soft, 2 finger breadths above the umbilicus, and deviated to the right. This is most likely an indication of: A. Normal involution. B. A full bladder. C. An infection pain. D. A hemorrhage. Answer: B. A full bladder. Explanation: A. Immediately after expulsion of the placenta, the fundus should be in the midline and remain firm. B. A boggy displaced uterus in the immediate postpartum period is a sign of urinary distension. Because uterine ligaments are stretched, a full bladder can displace the uterus. C. Symptoms of infection may include unusual uterine discomfort, temperature elevation, and foul-smelling lochia. The stem of this question does not address any of these factors. D. While excessive bleeding is associated with a soft, boggy uterus, the stem of this question includes displacement of uterus, which is more commonly associated with bladder distension. Question 661. A 64-year-old client is admitted to the hospital with benign prostatic hypertrophy, BPH. He has a history of adult-onset diabetes and hypertension and is scheduled to undergo a resection of the prostate. When recording his health history, the nurse asks about his chief complaint. The most serious symptom that may accompany BPH is: A. Acute urinary retention. B. Hesitancy in starting urination. C. Increased frequency of urination. D. Decreased force of the urinary stream. Answer: A. Acute urinary retention. Explanation: A. Acute urinary retention requires urgent medical attention. If measures such as a warm tub bath or warm tea do not occur after 6 hours, the client should go to the ED for catheterization. B, C, D. This choice is a symptom of BPH, but it is not serious or life-threatening. Question 662. The nurse is admitting an infant with bacterial meningitis and is prepared to manage the following possible effects of meningitis. A. Constipation. B. Hypothermia. C. Seizure. D. Sunken fontanelles. Answer: C. Seizure. Explanation: A. Constipation may occur if the child is dehydrated, but it is not directly associated with meningitis. B. It is more likely the child will have fever. C. Seizure is often the initial sign of meningitis in children and could become frequent. D. It is more likely the child will have bulging fontanelles. Question 663. On morning rounds, the nurse found a manic-depressive client who was taking lithium in a confused mental state, vomiting, twitching, and exhibiting a coarse hand tremor. Which one of the following nursing actions is essential at this time? A. Administer her next dosage of lithium, and then call the physician. B. Withhold her lithium, and report her symptoms to the physician. C. Place her on NPO to decrease the excretion of lithium from her body, and call the physician. D. Contact the lab and request a lithium level in 30 minutes, and call the physician. Answer: B. Withhold her lithium, and report her symptoms to the physician. Explanation: A. The client has lithium toxicity, and the nurse must withhold further dosages. B. Because of her level of toxicity, further lithium could cause coma and death. The nurse needs further orders from the physician to stabilize the client's lithium level. C. Ensuring adequate intake of sodium chloride will promote excretion of lithium and will assist in managing the client's lithium toxicity. D. A lithium blood level must be drawn immediately to determine the seriousness of the toxicity and to provide the physician with data for medical orders. Question 664. Following TURP, which of the following instructions would be appropriate to prevent or alleviate anxiety concerning the client's sexual functioning? A. You may resume sexual intercourse in 2 weeks. B. Many men experience impotence following TURP. C. A transurethral resection does not usually cause impotence. D. Check with your doctor about resuming sexual activity. Answer: C. A transurethral resection does not usually cause impotence. Explanation: A. Sexual activity should be delayed until cleared by the client's physician. B. Although many men experience retrograde ejaculation following prostate surgery, potency is seldom affected. C. Although the client may experience retrograde ejaculation, it will not limit his ability to engage in sexual intercourse. D. Although the client should obtain clearance from his physician before resuming sexual activity, this statement does not give the client any information or reassurance about future sexual activity or potency that could decrease his anxiety. Question 665. A client is medically cleared for ECT and is tentatively scheduled for 6 treatments over a 2-week period. Her husband asks, "Isn't that a lot?" The nurse's best response is A. Yes, that does seem like a lot. B. You'll have to talk to the doctor about that. The physician knows what's best for the client. C. 6 to 10 treatments are common. Are you concerned about permanent effects? D. Don't worry. Some clients have lots more than that. Answer: C. 6 to 10 treatments are common. Are you concerned about permanent effects? Explanation: A. This response indicates that the nurse is unsure of herself and not knowledgeable about ECT. It also reinforces the husband's fears. B. This response is passing the buck unnecessarily. The information needed to appropriately answer the husband's question is well within the nurse's knowledge base. C. The most common range for affective disorders is 610 treatments. This response confirms and reinforces the physician's plan for treatment. It also opens communication with the husband to identify underlying fears and knowledge deficits. D. This response offers false reassurance and dismisses the husband's underlying concerns about his wife. Question 666. A psychiatric nurse is providing an orientation to a new staff nurse. She reminds the nurse that psychiatrists often use categories of medications and that it is important that she recall that some categories of medications have synonyms. Another name used to describe minor tranquilizers is which of the following? A. Antipsychotic medications. B. Antidepressant medications. C. Anti-anxiety medications. D. Anti-mania medication. Answer: C. Anti-anxiety medications. Explanation: A. Antipsychotic medications are also known as major tranquilizers. B. Antidepressants fall into different categories, such as the tricyclics or the MAO inhibitors. C. Anti-anxiety medications are also known as minor tranquilizers. D. Anti-mania medications are those such as lithium and lithium carbonate, Lithobid. Question 667. The healthcare team determines that an elderly client has had progressive changes in memory over the last 2 years that have interfered with her personal, social, or occupational functioning. Her memory, learning, attention, and judgment have all been affected in some way. These symptoms describe which of the following conditions? A. Dementia. B. Parkinsonism. C. Delirium. D. Mania. Answer: A. Dementia. Explanation: A. These changes are common characteristics of dementia. B. Parkinson's disease affects the muscular system. Progressive memory changes are not presenting symptoms. C. Delirium includes an altered level of consciousness, which is not found in dementia. D. Mania includes symptoms of hyperactivity, flight of ideas, and delusions of grandeur. Question 668. A husband and wife and their 2 children, age 9 and age 5, are requesting family therapy. Which of the following strategies is most therapeutic for the nurse to use during the initial interaction with a family? A. Always allow the most vocal person to state the problem first. B. Encourage the mother to speak for the children. C. Interpret immediately what seems to be going on within the family. D. Allow family members to assume the seats as they choose. Answer: D. Allow family members to assume the seats as they choose. Explanation: A. One will always hear what the most vocal person has to say. It is best to start with the quietest family member to encourage that person to express emotions. B. All family members are encouraged to speak for themselves. C. In the initial family assessment, only data collection occurs, interpretations are made later. D. Allowing family members to choose their own seats will assist the nurse in assessing the family system and in determining who feels closer to whom. Question 669. A 2-year-old child with a scalp laceration and subdural hematoma of the temporal area as a result of falling out of bed should be prevented from A. Crying. B. Falling asleep. C. Rolling from his back to his tummy. D. Sucking his thumb. Answer: A. Crying. Explanation: A child with a subdural hematoma has increased ICP. Crying may significantly increase this pressure. B. Adequate sleep is essential, but it is important that the child can be aroused from sleep after head injury. C. This child is free to roll from his back to his abdomen. D. Thumbsucking serves to reduce anxiety and should not be prevented at this time. Question 670. The nurse is caring for a 2-year-old girl with a subdural hematoma of the temporal area as a result of falling out of bed and notices that she has a runny nose. The nurse should: A. Call the doctor immediately. B. Help her to blow her nose carefully. C. Test the discharge for sugar. D. Turn her to her side. Answer: C. Test the discharge for sugar. Explanation: A. The nasal discharge could be due to a cold. It is necessary to gather additional assessment data to identify a possible cerebrospinal fluid leak. B. If the discharge is cerebrospinal fluid, it would not be safe to encourage the girl to blow her nose. C. Cerebrospinal fluid is positive for sugar, mucus is not. D. Turning her to her side will have no effect on her runny nose. It is necessary to gather further assessment data. Question 671. Early in her 9th month of pregnancy, a client has been diagnosed as having mild preeclampsia. In counseling her about her diet, the nurse must emphasize the importance of: A. Decreasing her sodium intake. B. Decreasing her fluids. C. Increasing her carbohydrate intake. D. Eating a moderate to high-protein diet. Answer: D. Eating a moderate to high-protein diet. Explanation: A. Women with pregnancy-induced hypertension have a reduced plasma volume secondary to venous vessel constriction, not hypovolemia, therefore, sodium restriction is not recommended. It is suggested that these women avoid extremely salty foods. B. Drinking 6 to 8 glasses of water per day facilitates optimal fluid volume and renal perfusion, but it will not decrease the venous vessel constriction of pregnancy-induced hypertension. C. Carbohydrate needs increase during pregnancy, specifically during the 2nd and 3rd trimesters, but they have not been linked to pregnancy-induced hypertension. D. Loss of urinary protein, proteinuria, is associated with increased permeability of the large protein molecules with pregnancy-induced hypertension. Additional dietary protein also helps increase the plasma colloidal osmotic pressure. Diets deficient in protein have been linked to pregnancy-induced hypertension. Question 672. A client undergoes a transurethral resection, prostate, TURP. He returns from surgery with a 3-way continuous Foley irrigation of normal saline in progress. The purpose of this bladder irrigation is to prevent: A. Bladder spasms. B. Clot formation. C. Scrotal edema. D. Prostatic infection. Answer: B. Clot formation. Explanation: A. The purpose of bladder irrigation is not to prevent bladder spasms, but to drain the bladder and decrease clot formation and obstruction. B. A 3-way system of bladder irrigation will cleanse the bladder and prevent formation of blood clots. A catheter obstructed by clots or other debris will cause prostatic distension and hemorrhage. C. Scrotal edema seldom occurs after TURP. Bladder irrigation will not prevent this complication. D. Prostatic infection seldom occurs after TURP. Bladder irrigation will not prevent this complication. Question 673. A 20-year-old female client delivers a stillborn infant. Following the delivery, an appropriate response by the labor nurse to the question, "Why did this happen to my baby?" is: A. It's God's will. It was probably for the best. There was something probably wrong with your baby. B. You're young. You can have other children later. C. I know your other children will be a great comfort to you. D. I can see you're upset. Would you like to see and hold your baby? Answer: D. I can see you're upset. Would you like to see and hold your baby? Explanation: A. The mother and the father require support. The nurse should not minimize their grief in this situation. B. Attachment to this infant occurs during the pregnancy for both the mother and father. Another child cannot replace this child. C. Attachment to this infant occurs during the pregnancy for both the mother and father. Siblings will not replace their feelings or minimize their loss of this infant. D. Holding and viewing the infant decreases denial and may facilitate the grief process. The nurse should prepare family members for how the infant appears, she is bruised, and provide support. Question 674. A male client is experiencing auditory hallucinations. His nurse enters the room and he tells her that his mother is talking to him, and he will take his medicine after she leaves. The nurse looks around the room and sees that she and the client are the only ones in the room. The nurse's most therapeutic response will be: A. I don't see your mother in the room. Let's talk about how you're feeling. B. Okay, I'll come back later when you're feeling more like taking your medicine. C. She may be here, but I can't see her. D. Why don't you finish talking to her, and I'll wait. Answer: A. I don't see your mother in the room. Let's talk about how you're feeling. Explanation: A. This response uses the principle of reality orientation by the nurse telling the client that he or she does not see anything, but it does recognize his feelings. B. This response does not make it clear that the nurse does not see anyone else in the room, and the nurse leaves the client alone to continue hallucinating. C. This response leaves room for doubt. The nurse is further confusing the client by this statement. D. This response reinforces the hallucination and implies that the nurse sees his mother, too. Question 675. Before giving methergine postpartum, the nurse should assess the client for: A. Decreased amount of lochial flow. B. Elevated blood pressure. C. Flushing. D. After pains. Answer: B. Elevated blood pressure. Explanation: A. Methergine is given to contract the uterus and to control postpartum hemorrhage, therefore, lochial flow should decrease. B. Methergine may elevate the blood pressure. A client with an elevated blood pressure should not receive methergine, but she could be given oxytocin if necessary. C. Flushing is not a side effect of methergine. D. After pains are increased with methergine usage. The client should be informed that this is a normal response. Question 676. The nurse and prenatal client discuss the effects of cigarette smoking on pregnancy. It would be correct for the nurse to explain that with cigarette smoking there is increased risk that the baby will have: A. A low birth weight. B. A birth defect. C. Anemia. D. Nicotine withdrawal. Answer: A. A low birth weight. Explanation: A. Women who smoke during pregnancy are at increased risk for miscarriage, preterm labor, and IUGR in the fetus. B. Although smoking produces harmful effects on the maternal vascular system and the developing fetus, it has not been directly linked to fetal anomalies. C. Smoking during pregnancy has not been directly linked to anemia in the fetus. D. Smoking during pregnancy has not been linked to nicotine withdrawal symptoms in the newborn. Question 677. The client will be more comfortable and the results more accurate when the nurse prepares the client for Leopold's maneuvers by having her: A. Empty her bladder. B. Lie on her left side. C. Place her arms over her head. D. Force fluids 1 hour prior to procedure. Answer: A. Empty her bladder. Explanation: A. A full bladder would cause discomfort and possible urinary incontinence during the exam. B. The left side lying position would not accommodate the exam. The head of the exam table or bed can be slightly elevated to prevent supine hypotension. C. Arms extended over the head would cause the abdomen to be tighter and less easily palpable. D. Forcing fluids would encourage a full bladder, which is not desired for the exam. Question 678. An IDDM client's condition stabilizes. He begins to receive a daily injection of NPH insulin at 6:30 a.m. The nurse can most likely expect a hypoglycemic reaction to occur that same day at A. 8:30 a.m. to 10:30 a.m. B. 2:30 p.m. to 4:30 p.m. C. 7:30 p.m. to 9:30 p.m. D. 10:30 p.m. to 11:30 p.m. Answer: B. 2:30 p.m. to 4:30 p.m. Explanation: A. This time describes the time of onset of NPH insulin's action, rather than its peak effect. B. NPH insulin, an intermediate-acting insulin, usually begins to lower serum glucose levels about 2 hours after administration. The action of NPH insulin peaks 814 hours after administration. It has a 20-30 hour duration. C. The time stated is not the time of peak action for NPH insulin administered at 6:30 a.m. D. The time stated is not the time of peak action for NPH insulin administered at 6:30 a.m. Question 679. A client is being admitted to the labor and delivery unit. She has had previous admissions for false labor. Which clinical manifestation would be most indicative of true labor? A. Increased bloody show. B. Progressive dilatation and effacement of the cervix. C. Uterine contractions. D. Decreased discomfort with ambulation. Answer: B. Progressive dilatation and effacement of the cervix. Explanation: A. Bloody show is considered a sign of imminent labor, which usually begins in 24-48 hours. An increase in bloody show is an indication that the cervix is changing. B. Contractions of true labor produce progressive cervical effacement and dilatation. C. Contractions of false labor may mimic those of true labor. However, the contractions of false labor do not produce progressive effacement and dilatation of the cervix. D. In true labor, the discomfort is not relieved by ambulation. Walking may intensify the discomfort. Question 680. In acute episodes of mania, lithium is effective in 12 weeks, but it may take up to 4 weeks, or even a few months, to treat symptoms fully. Sometimes an antipsychotic agent is prescribed during the first few days or weeks of an acute episode to manage severe behavioral excitement and acute psychotic symptoms. In addition to the lithium, which one of the following medications might the physician prescribe? A. Diazepam, Valium. B. Haloperidol, Haldol. C. Sertraline, Zoloft. D. Alprazolam, Xanax. Answer: B. Haloperidol, Haldol. Explanation: A. Diazepam is an anti-anxiety medication and is not designed to reduce psychotic symptoms. B. Haloperidol is an antipsychotic medication and may be used until the lithium takes effect. C. Sertraline is an antidepressant and is used primarily to reduce symptoms of depression. D. Alprazolam is an anti-anxiety medication and is not designed to reduce psychotic symptoms. Question 681. A client has had amniocentesis. One of the tests performed on the amniotic fluid is a lecithin/sphingomyelin, L/S, ratio. The results show a ratio of 1:1. This is indicative of A. Lung immaturity. B. Intrauterine growth retardation, IUGR. C. Intrauterine infection. D. Neural tube defect. Answer: A. Lung immaturity. Explanation: A. At about 3,032 weeks gestation, the amounts of the surfactants, lecithin, and sphingomyelin become equal. As the fetal lungs mature, the concentration of lecithin begins to exceed that of sphingomyelin. At 35 weeks, the L/S ratio is 2:1. Respiratory distress syndrome is unlikely if birth occurs at this time. B. IUGR is associated with compromised uteroplacental perfusion or with viral infections, chromosomal disorders, congenital malformations, and maternal malnutrition. IUGR is not specifically assessed by analysis of the L/S ratio. C. Analysis of the L/S ratio is not an assessment used to confirm intrauterine infection. D. Elevated levels of _fetaprotein in maternal serum or in amniotic fluid have been found to reflect open neural tube defects, such as spina bifida and anencephaly. Question 682. A 2-year-old boy fell out of bed and has a subdural hematoma. When his mother leaves him for the first time, you will expect the child to A. Be comforted when he is held. B. Cry. C. Not notice that his mother has left. D. Withdraw and become listless. Answer: B. Cry. Explanation: A. It will be difficult to comfort a 2-year-old with a headache without his mother. B. This baby probably will cry, which should be prevented because it will increase his intracranial pressure, ICP. Asking the mother to wait until the baby is asleep may help. C. An awake 2-year-old will notice when his mother leaves. D. An older child may withdraw when feeling afraid, but a 2-year-old will probably show more aggressive behavior. Question 683. A client is pleased about being pregnant, yet states, "It is really not the best time, but I guess it will be okay." The nurse's assessment of this response is: A. Initial maternal-infant bonding may be poor. B. Client may have a poor relationship with her husband. C. This response is normal in the first trimester. D. This response is abnormal, to be re-evaluated at the next visit. Answer: C. This response is normal in the first trimester. Explanation: A. Ambivalence is normal during the first trimester. Riva Rubin addresses the issue of not now in the first trimester. The statement still leaves room for exploration. B. There are no data to support this. This statement by the mother still leaves room for exploration. C. Ambivalence is normal during the first trimester. Riva Rubin addresses the issue of not now. This fact should be shared with the mother during further exploration of the comment. D. It is not abnormal. If it were, another month would also be too long to wait. Question 684. A client is a victim of domestic violence. She is now receiving assistance at a shelter for battered women. She tells the nurse about the cycle of violence that she has been experiencing in her relationship with her husband of 5 years. In the tension-building phase, the nurse might expect the client to describe which of the following: A. Promises of gifts that her husband made to her. B. Acute battering of the client, characterized by his volatile discharge of tension. C. Minor battering incidents, such as the throwing of food or dishes at her. D. A period of tenderness between the couple. Answer: C. Minor battering incidents, such as the throwing of food or dishes at her. Explanation: A. This description is characteristic of the honeymoon or respite phase. B. This description is characteristic of the battering phase. C. This description is characteristic of the tension-building phase prior to the volatile discharge of tension found in the battering phase. D. This description is characteristic of the honeymoon or respite phase. Question 685. In teaching the client about proper umbilical cord care, the nurse recommends that A. Petrolatum be placed around the cord after the sponge bath. B. A belly binder be applied to prevent umbilical hernia. C. The area be cleansed at diaper changes with alcohol and inspected for redness or drainage. D. The cord clamp be left on until the cord stump separates. Answer: C. The area be cleansed at diaper changes with alcohol and inspected for redness or drainage. Explanation: A. Petrolatum does not allow the cord to dry and will encourage infection. B. Belly binders do not facilitate drying of the cord and will encourage abdominal relaxation. C. Frequent applications of alcohol will facilitate drying and discourage infection. D. The cord clamp can be removed in 24 hours. Leaving it on is cumbersome and could pull on the cord unnecessarily. Question 686. A client presented herself to the mental health center, describing the following symptoms: a weight loss of 20 pounds in the past 2 months, difficulty concentrating, repeated absences from work due to fatigue, and not wanting to get dressed in the morning. She leaves her recorded message on her telephone and has lost interest in answering the phone or doorbell. The nurse's assessment of her behavior would most likely be: A. Deep depression. B. Psychotic depression. C. Severe anxiety. D. Severe depression. Answer: D. Explanation: A. A client in deep depression would have been brought to the mental health center and would not be physically able to seek help for herself. B. She is not manifesting psychotic symptoms in her behaviors. C. The client's symptoms are more indicative of depression than anxiety. D. Although the client was able to bring herself to the mental health center, the extent of her weight loss and the interference of symptoms with activities of daily living indicate that she is severely depressed. Question 687. A new mother experiences strong uterine contractions while breastfeeding her baby. She excitedly rings for the nurse. When the nurse arrives, the mother tells her, "Something is wrong. This is like my labor." Which reply by the nurse identifies the physiological response of the client? A. Your breasts are secreting a hormone that enters your bloodstream and causes your abdominal muscles to contract. B. Prolactin increases the blood supply to your uterus, and you are feeling the effects of this blood vessel engorgement. C. The same hormone that is released in response to the baby's sucking, causing milk to flow, also causes the uterus to contract. D. There is probably a small blood clot or placental fragment in your uterus, and your uterus is contracting to expel it. Answer: C. The same hormone that is released in response to the baby's sucking, causing milk to flow, also causes the uterus to contract. Explanation: A. Mammary growth as well as milk production and maintenance in the breast occur in response to hormones produced primarily by the hypothalamus and the pituitary gland. B. Prolactin stimulates the alveolar cells of the breast to produce milk. It is important in the initiation of breastfeeding. C. Oxytocin, which is released by the posterior pituitary, stimulates the letdown reflex by contraction of the myoepithelial cells surrounding the alveoli. In addition, it causes contractions of the uterus and uterine involution. D. After pains may occur with retained placental fragments. A boggy uterus and continued bleeding are other symptoms that occur in response to retained placental fragments. Question 688. A client with IDDM is given 4 insulin for a blood glucose level of 520 mg per deciliter. Life-threatening complications may occur initially, so the nurse will monitor him closely for serum. A. Chloride level of 99 milliequivalent/L. B. Sodium level of 136 milliequivalent/L. C. Potassium level of 3.1 milliequivalent/L. D. Potassium level of 6.3 milliequivalent/L. Answer: D. Potassium level of 6.3 milliequivalent/L. Explanation: A. The chloride level is within acceptable limits. B. The sodium level is within acceptable limits. C. This value indicates hypokalemia, rather than the hyperkalemia that occurs during diabetic ketoacidosis. D. When diabetic ketoacidosis exists, intracellular dehydration occurs and potassium leaves the cells and enters the vascular system, thus increasing the serum level beyond an acceptable range. When insulin and fluids are administered, cell walls are repaired and potassium is transported back into the cells. Normal serum potassium levels range from 3.55.0 milliequivalent/L. Question 689. A client is admitted to the labor room. She is dilated 4 centimeters. She is placed on electric fetal monitoring. Which of the following observations necessitates notifying the physician? A. Contractions every 2 minutes, lasting 100 seconds. B. Fetal heart decelerations during a contraction. C. Beat-to-beat variability between contractions. D. Fetal heart decelerations at the beginning of contractions. Answer: A. Contractions every 2 minutes, lasting 100 seconds. Explanation: A. These are tetanic in nature and can cause rupture of the uterus. B. The FHR decreases during contractions owing to vasoconstriction and should recover after the contraction. C. Beat-to-beat variability is a normal finding and demonstrates fetal well-being. D. The FHR may decrease at the beginning of a contraction owing to head compression. Question 690. The nurse is caring for a 3-month-old girl with meningitis. She has a positive Koenig's sign. The nurse expects her to react to discomfort if she: A. Dorsiflexes her ankle. B. Flexes her spine. C. Plantarflexes her wrist. D. Turns her head to the side. Answer: B. Flexes her spine. Explanation: A. Discomfort with ankle dorsiflexion is not expected with meningitis. B. Spinal flexion, flexing the neck or the hips with legs extended, causes discomfort if the meninges are irritated. C. Discomfort with wrist flexion is not expected with meningitis. D. Rotating the cervical spine may cause discomfort with meningitis, but pain with flexion is more indicative of meningeal irritation. Question 691. A client's membranes have just ruptured spontaneously. Which of the following nursing actions should take priority? A. Assess quantity of fluid. B. Assess color and odor of fluid. C. Document on fetal monitor strip and chart. D. Assess fetal heart rate, FHR. Answer: D. Assess fetal heart rate, FHR. Explanation: A. Assessing the quantity of amniotic fluid is important as an indication of maternal fetal well-being, but it does not take priority over assessment of FHR. B. Greenish-brown discoloration of amniotic fluid indicates presence of meconium. Foul odor may indicate presence of infection. Both of these are important assessment data, but they do not take priority over possible life-threatening compression of the umbilical cord. C. Documentation is important, but it does not take priority over the possible life-threatening compression of the umbilical cord. D. If changes in the FHR are noted, the nurse should check for umbilical cord prolapse. This intervention has priority over the other actions. The danger of a prolapsed cord is increased once membranes have ruptured, especially if the presenting part of the fetus does not fit firmly against the cervix. Question 692. The nurse has been caring for a 16-year-old female who recently experienced date rape. After having had crisis intervention and been hospitalized for 2 weeks, the nurse knows that the client is effectively coping with the rape when she tells the nurse: A. I know it was my fault that it happened, because I shouldn't have been out so late. B. If I had not worn that sexy dress that night, he wouldn't have raped me. C. I know my date just had so much passion he couldn't handle me saying no. D. I know now that it was not my fault, but I want to continue counseling after my discharge. Answer: D. I know now that it was not my fault, but I want to continue counseling after my discharge. Explanation: A. This response does not show any insight. The client falsely assumes that she is responsible for the rape. B. The client continues to falsely assume responsibility for the rapist's behavior. C. The client believes falsely that rape is an act of passion, rather than one of violence, control, and domination. D. The client has insight into the rape, she does not believe it was her fault and shows good judgment in deciding to continue with counseling after discharge. Question 693. A 2-year-old boy is in the hospital outpatient department for observation after falling out of his crib and hitting his head. The nurse calls the physician to report. A. Evidence of perineal irritation. B. Pulse fell from 102 to 96. C. Pulse increased from 96 to 102. D. Temperature rose to 102_F rectally. Answer: D. Temperature rose to 102_F rectally. Explanation: A. Perineal irritation needs to be addressed, but it is probably not necessary to call the physician. B. This fall in pulse rate remains within normal limits and is probably insignificant. It is important to monitor for continued change. C. This rise in pulse rate is probably not significant, but it is important to monitor for continued change. D. This temperature is above normal limits and needs medical investigation. It may or may not be related to the head injury. Question 694. A client who has been diagnosed with anorexia nervosa reluctantly agrees to eat. All important intervention in monitoring her dietary compliance would be to: A. Allow her privacy at mealtimes. B. Praise her for eating everything. C. Observe behavior for 1 to 2 hours after meals to prevent vomiting. D. Encourage her to eat in moderation, choose foods that she likes, and avoid foods that she dislikes. Answer: C. Observe behavior for 1 to 2 hours after meals to prevent vomiting. Explanation: A. Eating alone is not recommended for anorexic clients because they tend to hoard food instead of eating it. B. The client should be praised for whatever she eats, which is usually a small portion or percentage of what is served. Praise should not be withheld until she eats everything. C. The client should be observed dietary for at least 1 hour following meals to prevent discarding food stashed in her clothing at mealtime or engaging in self-induced vomiting. D. If offered these choices, the client would choose low-caloric foods, not a nutritious diet. Question 695. A 48-year-old male client is hospitalized with mild ascites, bruising, and jaundice. He has a 20-year history of alcohol abuse. The client is diagnosed with cirrhosis. His serum ammonia level is high, indicating hepatic encephalopathy. He has esophageal varices. Which of the following may cause the varices to rupture? A. Lifting heavy objects. B. Walking briskly. C. Ingestion of barbiturates. D. Ingestion of antacids. Answer: A. Lifting heavy objects. Explanation: A. Lifting heavy objects will increase intrathoracic pressure, thus placing the client at risk for rupturing esophageal varices. B, C, D. This activity will not cause an increase in intrathoracic pressure. Question 696. When discussing the relationship between exercise and insulin requirements, a 26-year-old client with IDDM should be instructed that: A. When exercise is increased, insulin needs are increased. B. When exercise is increased, insulin needs are decreased. C. When exercise is increased, there is no change in insulin needs. D. When exercise is decreased, insulin needs are decreased. Answer: B. When exercise is increased, insulin needs are decreased. Explanation: A. If the client's insulin is increased when activity level is increased, hypoglycemia may result. B. Exercise decreased the blood sugar by promoting uptake of glucose by the muscles. Consequently, less insulin is needed to metabolize ingested carbohydrates. Extra food may be required for extra activity. C. This statement directly contradicts the correct answer and is inaccurate. D. When exercise is decreased, the client's insulin dose does not need to be altered unless the blood sugar becomes unstable. Question 697. A client delivered a term infant 1 hour ago. Her uterus on assessment is boggy and is U+1 in contrast to the previous assessment of U_2. The immediate nursing response is to A. Administer Methergine IM. B. Remove the retained placental fragments. C. Assist the client to the bathroom and provide cues to stimulate urination. D. Massage the fundus until firm. Answer: D. Massage the fundus until firm. Explanation: A. Methergine is given following placental delivery to promote uterine contractions and prevent hemorrhage. Methergine may be administered in this clinical situation, but fundal massage would be the first response. B. Removal of retained placental fragments is done by the physician and is not the first response. C. If the fundus rises and is deviated, particularly to the right, the nurse should suspect bladder distension secondary to bladder and urethral trauma associated with birth and decreased bladder tone following delivery. Therefore, women have a diminished sensation to void. D. A boggy fundus rises and is indicative of blood pooling, predisposing the woman to clot formation. Massage the uterus until firm. Too vigorous massage will result in autonia. Clots may be expelled by a kneading motion of the uterus by the nurse. Question 698. In counseling a client, the nurse emphasizes the danger signals during pregnancy. On the next visit, the client identifies which of the following as a danger signal that should be reported immediately. A. Backache. B. Leaking of clear yellow fluid from breasts. C. Constipation with hemorrhoids. D. Visual changes. Answer: D. Visual changes. Explanation: A. Backache is a common complaint during pregnancy. Proper body mechanics, pelvic rock, back rubs, and other comfort measures should relieve the discomfort. In the presence of uterine contractions, the backache would radiate to the lower abdomen. B. Colostrum is normal and can be present anytime in the second half of pregnancy. C. Constipation and hemorrhoids are common and do need attention, but they do not constitute a dangerous situation. D. Visual changes are possibly related to PIH. The client should be assessed immediately to rule out or prevent worsening of PIH. Question 699. A pregnant client complains of varicosities in the third trimester. Which of the following activities should she be advised to avoid? A. Sitting with legs crossed at ankles. B. Wearing thromboembolic disease, TED, stockings. C. Wearing support pantyhose. D. Wearing knee-high stockings. Answer: D. Wearing knee-high stockings. Explanation: A. Sitting with the legs crossed at the ankles does not interfere with circulation or create pressure points. B. TED stockings will help to reduce the varicosity by supporting the vein. Stockings must be applied with legs elevated. C. Support pantyhose help to reduce the varicosity by supporting the vein. They also provide support to the uterus and allow for better return circulation. Hose must be applied like TED stockings. D. Knee-high stockings create constriction and pressure points that interfere with circulation in the lower extremities. Question 700. A baby is circumcised. Immediate postoperative care should include: A. Applying a loose diaper. B. Keeping the baby NPO for 4 hours to avoid vomiting. C. Changing the dressing frequently using dry, sterile gauze. D. Taking the baby to his mother for cuddling. Answer: D. Taking the baby to his mother for cuddling. Explanation: A. A pressure diaper should be applied to discourage hemorrhage. B. The baby can be fed by his mother soon after the procedure, once it is assessed that he is not in any distress and is stable. C. Dressing changes should not be dry. Dry dressing will stick. D. Cuddling after the procedure will hopefully quiet the baby. Feeding is also important if his feeding was withheld prior to the procedure or it is time for a feeding. Question 701. A family is experiencing changes in their lifestyle in many ways. The invalid grandmother has moved in with them. The couple have a 2-year-old son by their marriage, and the wife has 2 children by her previous marriage. The older children are in high school. In applying systems theory to this family, it is important for the nurse to remember which of the following principles? A. The parts of a system are only minimally related. B. Dysfunction in one part affects every other part. C. A family system has no boundaries. D. Healthy families are enmeshed. Answer: B. Dysfunction in one part affects every other part. Explanation: A. The parts of a system are interrelated. B. Any change in any part of the system affects all other parts. C. A family system, like any other system, has boundaries. D. Healthy families are neither enmeshed nor disengaged. Question 702. A client is having an amniocentesis. Prior to the procedure, an ultrasound is performed. In preparing the client, the nurse explains the reason for a sonogram in this situation to be: A. Determination of multiple gestations. B. Determination of gross anomalies. C. Determination of placental location. D. Determination of fetal age. Answer: C. Determination of placental location. Explanation: A. Sonography can be used to determine the presence of multiple gestation. In this question, the sonogram is used as a preparatory step for a specific invasive procedure. B. Sonography can be used to determine the presence of gross anomalies. In this question, the sonogram is used as a preparatory step for a specific invasive procedure. C. Prior to amniocentesis, the abdomen is scanned by ultrasound to locate the placenta, thus reducing the possibility of penetrating it with the spinal needle used to obtain amniotic fluid. D. Sonography can be used to determine fetal age. In this question, the sonogram is used as a preparatory step for a specific invasive procedure. Question 703. The physician of a client diagnosed with alcoholism orders neomycin 0.5 GQ6H to prevent hepatic coma. Neomycin decreases serum ammonia levels by: A. Decreasing nitrogen-forming bacteria in the intestines. B. Acidifying colon contents by causing ammonia retention in the colon. C. Decreasing the uptake of vitamin D, thereby drawing more water into the colon. D. Irritating the bowel and promoting evacuation of stool. Answer: A. Decreasing nitrogen-forming bacteria in the intestines. Explanation: A. Neomycin interferes with protein synthesis in the bacterial cell, causing bacterial death. Neomycin reduces the growth of the ammonia-producing bacteria in the intestines and is used for the treatment of hepatic coma. B. This choice describes the action of lactulose, another drug commonly used to decrease systemic ammonia levels. C. Neomycin's action decrease uptake of vitamin D to reduce serum ammonia levels. D. Bowel irritation with diarrhea is more likely to occur with administration of lactulose rather than of neomycin. Besides, diarrhea is a side effect of a drug, not the action of the drug. Question 704. A 14-year-old boy fell off his bike while popping a wheelie on the dirt trails. He has sustained a head injury with laceration of his scalp over his temporal lobe. If he were to complain of headache during the first 24 hours of his hospitalization, the nurse would A. Ask the physician to order a sedative. B. Have the client describe his headache every 15 minutes. C. Increase his fluid intake to 3,000 milliliters per 24 hours. D. Offer diversionary activities. Answer: D. Offer diversionary activities. Explanation: A. CNS depressants are not given for headache due to head injury because they would mask changes in neurological status and because they could further depress the CNS. B. The client should not be asked to think about his headache every 15 minutes. C. Fluid intake should be normal or restricted for a client with a head injury. Normal fluid intake for a 14-year-old is about 20,002,400 milliliters daily. D. Diversion may help the child to focus on a pleasant activity instead of on his headache. Question 705. The nurse is caring for a 6-week-old girl with meningitis. To help her develop a sense of trust, the nurse should A. Give her a small soft blanket to hold. B. Give her good perineal care after each diaper change. C. Leave the door open to her room. D. Pick her up when she cries. Answer: D. Pick her up when she cries. Explanation: A. A soft blanket may be comforting, but it is not directed toward developing a sense of trust. B. Good perineal care is important, but it is not directed toward developing a sense of trust. C. An infant with meningitis needs frequent attention, but leaving the door open does not foster trust. D. Consistently picking her up when she cries will help the child feel trust in her caregivers. Question 706. Assessment of a client reveals a 30% loss of pre-illness weight, lanugo, and cessation of menses for 3 months. Her vital signs are BP 90/50ths, P96 BPM, respirations 30, and temperature 97 F. She admits to the nurse that she has induced vomiting 3 times this morning, but she had to continue exercising to lose just 5 more pounds. Her symptoms are consistent with A. Pregnancy. B. Bulimia. C. Gastritis. D. Anorexia nervosa. Answer: D. Anorexia nervosa. Explanation: A. Presenting behaviors collectively are inconsistent with depression. B. A pre-illness weight loss of 30%, lanugo, and cessation of menses are inconsistent with bulimia. C. Symptoms and vital signs do not indicate the presence of infection. D. All symptoms and vital signs are consistent with anorexia nervosa. Question 707. The nurse is trying to help a mother understand what is happening with her son who has recently been diagnosed with paranoid schizophrenia. At present, he is experiencing hallucinations and delusions of persecution and suffers from poor hygiene. The nurse can best help her understand her son's condition by which of the following statements? A. Sometimes these symptoms are caused by an overstimulation of a chemical called dopamine in the brain. B. Has anyone in your family ever had schizophrenia? C. If your son has a twin, he probably will eventually develop schizophrenia, too. D. Some of his symptoms may be a result of his lack of a strong mother-child bonding relationship. Answer: A. Sometimes these symptoms are caused by an overstimulation of a chemical called dopamine in the brain. Explanation: A. The most plausible theory to date is that dopamine causes an overstimulation in the brain, which results in the psychotic symptoms. B. This statement will only create anxiety in the mother, and the genetic theory is only one of the etiological factors. C. This statement will cause the mother much alarm, and nothing was mentioned about any other child. D. The mother-child relationship is one of the previous theories examined, but it is not one to be emphasized, thereby causing a lot of anxiety for the mother. Question 708. In healthcare settings, nurses must be familiar with primary, secondary, and tertiary levels of care. As a nurse in the community, which of the following interventions might be a primary prevention strategy? A crisis intervention with an intoxicated teenager whose mother just committed suicide. B. Referring a client who has been on a detoxification unit to a rehabilitation center. C. Teaching 5th grade children the harmful effects of substance abuse. D. Counseling a client with post-traumatic stress disorder. Answer: C. Teaching 5th grade children the harmful effects of substance abuse. Explanation: A. The teenager is already coping ineffectively and requires early detection and treatment, which is secondary prevention. B. The client must be sent to a rehabilitation unit, which requires tertiary prevention. C. Reducing the incidence of disease through education supports primary prevention. D. A client with identified symptoms of post-traumatic stress disorder requires intervention by treatment. Question 709. Which of the following blood values would require further nursing action in a newborn who is 4 hours old? A. Hemoglobin 17.2 g/dl. B. Platelets 250,000/mm3. C. Serum glucose 30 mg per deciliter. D. White blood cells 18,000/mm3. Answer: C. Serum glucose 30 mg per deciliter. Explanation: A. The normal range for hemoglobin in the newborn is 1719 g/dl, 17.2 g/dl is within normal limits. B. A normal value range for platelets in the newborn is 150,000,400,000mm3, 250,000/mm3 is within normal range. C. A serum glucose of 30 mg per deciliter in the first 72 hours of life is indicative of hypoglycemia and warrants further intervention. D. On the day of birth, a white blood cell count of 18,000,040,000/mm3 is normal in the newborn. Question 710. A 42-year-old male client has been treated at an alcoholic rehabilitation center for physiological alcohol dependence. The nurse will be able to determine that he is preparing for discharge and is effectively coping with his problem when he shares with her the following information. A. I know that I will not ever be able to socially drink alcohol again and will need the support of the AA group. B. I know that I can only drink 1 or 2 drinks at social gatherings in the future, but at least I don't have to continue AA. C. I really wasn't addicted to alcohol when I came here, I just needed some help dealing with my divorce. D. It really wasn't my fault that I had to come here. If my wife hadn't left, I wouldn't have needed those drinks. Answer: A. I know that I will not ever be able to socially drink alcohol again and will need the support of the AA group. Explanation: A. The client has insight into the severity of his alcohol addiction and has chosen one of the most effective treatment strategies to support him, Alcoholics Anonymous. B. The client is still using denial and is not dealing with his alcohol addiction. C. The client is exhibiting denial about his alcohol addiction and projecting blame on his divorce. D. The client is projecting blame onto his wife for being in the hospital while still denying his alcohol addiction. Question 711. A husband asks if he can visit with his wife on her ECT treatment days and what to expect. Response is: A. You'll have to get permission from the physician to visit. Clients are pretty sick after the first treatment. B. Visitors are not allowed. We will telephone you to inform you of her progress. C. There's really no need to stay with her. She's going to sleep for several hours after the treatment. D. Yes, you may visit. She may experience temporary drowsiness, confusion, or memory loss after each treatment. Answer: D. Yes, you may visit. She may experience temporary drowsiness, confusion, or memory loss after each treatment. Explanation: A. It is within the nurse's realm of practice to grant visiting privileges according to hospital policy. ECT treatments do not make clients sick. B. Visitors are allowed and encouraged, particularly family members. C. Clients are usually awake within 1 hour post-treatment. Drowsiness wanes as the anesthetic wears off. D. A family member is encouraged to stay with the client after return to the unit. The nurse has used an opportunity to do family teaching and allay fears by explaining temporary side effects of the treatment. Question 712. After several days, an IDDM client's serum glucose stabilizes, and the registered nurse continues client teaching in preparation for his discharge. The nurse helps him plan an American Diabetes Association diet and explains how foods can be substituted on the exchange list. He can substitute 1 ounce of poultry for A. 1 frankfurter, B. 1 ounce of ham, C. 2 slices of bacon, D. 1/4 cup dry cottage cheese. Answer: D. 1/4 cup dry cottage cheese. Explanation: A. A frankfurter is a high-fat meat on the diabetic exchange list. B. Ham is a medium-fat meat on the diabetic exchange list, unless it is a center-cut slice. C. 1 strip of bacon exchange. Dietary substitutions should occur within exchange lists and not between exchange lists. D. Diabetic meat exchange lists are categorized into lean meat foods, medium-fat meats, and high-fat meats. Cottage cheese, dry, 2% butterfat, 1/4 cup, can substitute for 1 lean meat exchange. Question 713. While the nurse is taking a male client's blood pressure, he makes flirtatious remarks to her. The nurse will handle this effectively if she A. Politely tells the client, "Keep your hands off." B. Ignores the remarks and hopes he will not try it again. C. Confronts the remarks but attempts not to reject the client. D. Leaves the room in order to compose herself. Answer: C. Confronts the remarks but attempts not to reject the client. Explanation: A. This response does not recognize normal feelings of attraction and rejects the client. B. By ignoring the situation, the nurse has not set limits to discourage other remarks or perhaps more sexually aggressive behavior. C. By confronting the remarks, she can recognize that his feelings of attraction may be normal but are not appropriate within the context of their nurse-client relationship. D. Leaving the room does not deal with setting limits for future interactions. Question 714. A client suspected of having anorexia nervosa is placed on bed rest with N4 infusion and a high-carbohydrate liquid diet. Within 72 hours, the results of her lab work show a return to normal limits. She is transferred to the psychiatric service for further treatment. A behavior modification plan is initiated. 3 days after her transfer, the client tells the nurse, "I haven't exercised in 6 days. I won't be eating lunch today." This statement by her most likely reflects A. Her lack of internal awareness about the outcome of the behavior. B. Increased knowledge about personal exercise plans. C. A manipulative technique to trick the nurse into allowing her to miss a meal. D. A true desire to stay fit while in the hospital. Answer: A. Her lack of internal awareness about the outcome of the behavior. Explanation: A. Indirect self-destructive behavior such as that seen in anorexia nervosa is characterized by the client's lack of insight and the awareness that the outcome of the dieting, exercising, and weight loss will ultimately result in death if uninterrupted. B. Although the client is knowledgeable about exercise, knowledge about the balance between nutrition, exercise, and rest is absent. C. The client's level of denial and lack of awareness disallow this behavior as a manipulative trick. D. The client's illness-maintaining behaviors are inconsistent with fitness. Question 715. In evaluating the effectiveness of magnesium sulfate, MgSO4, which of the following might indicate that the client was developing MgSO4 toxicity? A. A 31 patellar tendon reflex. B. Respirations of 12 breaths/min. C. Urine output of 40 milliliters per hour. D. A 21 proteinuria value. Answer: B. Respirations of 12 breaths/min. Explanation: A. Diminished, not accentuated, patellar tendon reflex is a sign of developing MgSO4 toxicity. A value of 21 is considered a normal tendon reflex, 3+ is considered brisker than normal. B. MgSO4 is a central nervous system, CNS, depressant. It also relaxes smooth muscle. If the respiratory rate is NLT, 16 bpm magnesium toxicity may be developing. C. Urine output of 40 milliliters per hour is enough to allow elimination of toxic levels of magnesium. Urinary output of NLT, 100 ml in a 4-hour period may result in toxic levels of magnesium. D. Presence of protein in the urine is a symptom of pregnancy-induced hypertension, PIH, a clinical syndrome for which magnesium sulfate is frequently used in medical management. Protein in the urine is not induced by magnesium sulfate intake. Question 716. A 14-year-old boy has a head injury with laceration of his scalp over his ear. The nurse should call the physician to report a blood pressure increase from 100/80 to 115/85 after lunch. B. Headache that is unresponsive to acetaminophen, Tylenol. C. Pulse rate ranges between 68 bpm and 76 bpm. D. Temperature rise to 102_F rectally. Answer: D. Temperature rise to 102_F rectally. Explanation: A. This change in blood pressure may not be significant and does not indicate a widening pulse pressure, a late sign of increased ICP. It is important to continue to monitor for change in blood pressure. B. Acetaminophen may be ineffective in relieving headache after head injury. Stronger analgesics are contraindicated because they mask neurological signs and may depress the CNS. C. Pulse rates between 68 bpm and 76 bpm are within normal limits for a 14-year-old child. It is important to monitor for a consistent drop in pulse rate, which is a late sign of increasing ICP. D. An elevated temperature is abnormal and requires further assessment and medical intervention. The temperature may be unrelated to the head injury, but CNS infection is serious and difficult to control. Question 717. A 7th grader lost consciousness after being hit in the head with a basketball. In the emergency room his vital signs are stable, and he demonstrates no neurologic deficit. He important that you advise his mother to A. Encourage him to drink plenty of fluids. B. Expect him to have nausea with vomiting. C. Keep him awake for the next 12 hours. D. Wake him up every 1 to 2 hours during the night. Answer: D. Wake him up every 1 to 2 hours during the night. Explanation: A. Fluid intake should be normal. Fluid intake may be restricted when there is a risk for increased ICP in a hospitalized client. B. Nausea is possible, but vomiting without nausea is more likely with increased ICP. Neither one should be expected, but the mother should know to notify the physician or hospital if they occur. C. The child does not need to be kept awake. It is important that he can be aroused from sleep. D. If the child cannot be awakened from sleep after head injury, it is an indication of serious increase in ICP. The mother should call an ambulance right away. Question 718. A client is resting comfortably after delivering her first child. When assessing her pulse rate, the nurse would recognize the following finding to be typical. A. Thready pulse. B. Irregular pulse. C. Tachycardia. D. Bradycardia. Answer: D. Bradycardia. Explanation: A. A thready pulse is indicative of hypotension and excessive blood loss and is often rapid. B. Pulse irregularities or dysrhythmias do not occur in the normal postpartum woman. C. Tachycardia occurs less frequently than bradycardia and is related to increased blood loss or prolonged difficult labor and/or birth. D. Puerperal bradycardia with rates of 5,070 bpm commonly occurs during the first 610 days of the postpartum period. It may be related to decreased cardiac strain, decreased blood volume, contraction of the uterus, and increased stroke volume. Question 719. A 35-year-old prima gravida comes to the clinic for her first prenatal visit. The midwife, on examining the client, suspects that she is approximately 11 weeks pregnant. The pregnancy is positively confirmed by finding A. Chadwick's sign. B. FHR by ultrasound. C. Enlargement of the uterus. D. Breast tenderness and enlargement. Answer: B. FHR by ultrasound. Explanation: A. Chadwick's sign is a presumptive sign of pregnancy. The coloration may not subside from past pregnancy or could be caused by other situations that create vasocongestion. B. FHR, movement, observed on ultrasound is a positive diagnosis of pregnancy. C. Enlargement of the uterus may be due to fibroids or infection. It is considered a probable sign. D. Breast tenderness and enlargement is a presumptive sign because it may be due to other conditions, such as premenstrual changes. Question 720. A chronic alcoholic client's condition deteriorates, and he begins to exhibit signs of hepatic coma. Which of the following is an early sign of impending hepatic coma? A. Hiccups. B. Anorexia. C. Mental confusion. D. Fader hepaticus. Answer: C. Mental confusion. Explanation: A. Hiccups are not a sign of impending hepatic coma. B. Anorexia is not a sign of impending hepatic coma. C. One of the earliest symptoms of hepatic coma is mental confusion. Asterixis, a flapping tremor of the hand, may also be seen. D. This sign is associated with the later stages of hepatic coma. Fader hepaticus, a characteristic odor on the breath that smells like acetone, may sometimes be noted when the liver fails. Question 721. A female client with major depression stated that life is hopeless and not worth living. The priority on which of the following questions? A. How has your appetite been recently? B. Have you thought about hurting yourself? C. How is your relationship with your husband? D. How has your depression affected your daily living activities? Answer: B. Have you thought about hurting yourself? Explanation: A. Although eating habits are important to assess, they are less important than suicidal intent. B. Maintenance of the client's life is the priority, assessment of suicidal intent is imperative. C. Relationships and support systems are an important part of assessment, but they are less important than suicidal intent. D. Daily living activities will give additional information about the level of depression, and are less significant than suicidal intent, although this information may give additional information about the actual plan for a suicidal attempt. Question 722. A female client has been treated since childhood for mitral valve prolapse. The antibiotic of choice for her during pregnancy would be A. Sulfa. B. Tetracycline. C. Hydralazine. D. Erythromycin. Answer: D. Erythromycin. Explanation: A. Sulfa is a teratogen and will cause kernicterus. B. Tetracycline is a teratogen and will affect tooth development. C. Hydralazine is not an antibiotic but a calcium channel blocker. D. Erythromycin is safe during pregnancy and can be used when the client is allergic to penicillin. Question 723. A female client admitted to the labor and delivery unit thinks her bag of water broke. Immediate nursing intervention would be to: A. Note the color and amount of fluid on her clothes. B. Assess the FHR. C. Notify the physician. D. Place the nitrazine test paper at the cervical OS and note the color change. Answer: B. Assess the FHR. Explanation: A. Amniotic fluid is generally pale and straw-colored. Meconium-stained amniotic fluid would indicate a previous hypoxic episode. This intervention, though appropriate, is not the immediate priority. B. With rupture of the membranes, the umbilical cord may prolapse if the presenting part does not fill the pelvis. Assessing FHR ascertains fetal well-being. C. More information regarding fetal status and assessing for membrane rupture is needed prior to contacting the physician. D. Nitrazine test paper differentiates amniotic fluid from urine. Amniotic fluid is normally alkaline in contrast to urine, which is acidic. This intervention, though appropriate, is not the immediate priority. Question 724. A client's prenatal screening indicated that she has no immunity to rubella. She is now 10 time to immunize her is: A. In the immediate postpartum period. B. After the first trimester. C. At 28 weeks gestation. D. Within 72 hours postpartum. Answer: A. Explanation: A. The rubella vaccine is made with attenuated virus and is given in the immediate postpartum period to prevent infection during pregnancy and subsequent adverse fetal and neonatal sequelae. Mothers are advised to prevent pregnancy for 3 months following immunization. B. Rubella infection during the second trimester may result in permanent hearing loss for the fetus. C. Rhogam is the drug generally administered at 28 weeks gestation to Rh-negative women. It is contraindicated to administer rubella vaccine during pregnancy. D. Rhogam is the drug administered within 72 hours postpartum to Rh-negative women to prevent the development of antibodies to fetal cells. Question 725. A 26-year-old female client presents at 10 weeks gestation. She currently is AG 31-0-1-1. Her mother and grandmother have heart disease. Her grandmother also has insulin-dependent diabetes. The client's previous delivery was a term female infant weighing 9 pounds 13 ounces. The client is 5 feet 6 inches tall and her current weight is 130 pounds. Based on her history, she is at risk for developing diabetes in pregnancy. Which of the following factors places her at risk for gestational diabetes? A. Age 25 years. B. Maternal weight. C. Previous birth of an infant weighing 9 lb. D. Family history of heart disease. Answer: C. Previous birth of an infant weighing 9 lb. Explanation: A. Maternal age older than 30 years is an identified risk factor for diabetes. Age younger than 30 years is insignificant for diabetes unless there is a familial history of diabetes. B. The client's weight is appropriate for her height. Obesity or pregnancy weight greater than 20% of the ideal weight is a contributing factor to the development of gestational diabetes. C. The birth of an infant weighing greater than 9 pounds, 4,000 g, is an identified risk factor for gestational diabetes. D. A familial history of heart disease is insignificant in the development of diabetes. However, a familial history of type 2 diabetes mellitus is identified as a risk factor in the development of diabetes during pregnancy. Question 726. A client suffering from schizophrenia has been taking chlorpromazine, Thorazine, for 6 months. On one of his follow-up visits to the mental health center, the nurse reports to the physician that he has developed tardive dyskinesia. Which of the following symptoms might she have observed in the client to support this conclusion? A. High fever, tachycardia, stupor, renal failure. B. Lip smacking, chewing, blinking, lateral jaw movements. C. Photosensitivity, orthostatic hypotension, dry mouth. D. Constipation, blurred vision, drowsiness. Answer: B. Lip smacking, chewing, blinking, lateral jaw movements. Explanation: A. These symptoms are found in clients with neuroleptic malignant syndrome. B. These symptoms are found in clients with tardive dyskinesia. C. These are normal side effects found in clients taking antipsychotic medications. D. These are also normal side effects found in clients taking antipsychotic medications. Question 727. The physician of an alcoholic client places him on a low-protein, high-carbohydrate diet. When choosing his menu, the client's best choice from the items below would be: A. Liver and onions, macaroni and cheese, tea with sugar. B. Baked chicken, baked potato with bacon bits, milk. C. Waffles with butter and honey, orange juice. D. Cheese omelette with ham and mushrooms, milk. Answer: C. Waffles with butter and honey, orange juice. Explanation: A, B, D. These foods are high in protein, which needs to be restricted. C. Serum ammonia levels can be decreased by restricting dietary protein intake. Waffles, honey, and orange juice are high in carbohydrate and low or completely lacking in protein. Butter, a concentrated fat, will provide extra calories. Question 728. The nurse assesses a client's monitor strip and finds the following: uterine contractions every 34 minutes, lasting 6,070 seconds, FHR baseline 134146 bpm, with accelerations to 158 bpm with fetal movement. Which nursing intervention is appropriate? A. Notify physician of non-reassuring FHR pattern. B. Turn the client to her left side. C. Start 4 for fetal distress and administer O2 at 6 to 8 liters by mask. D. Evaluate to see if the monitor strip is reassuring. Answer: D. Evaluate to see if the monitor strip is reassuring. Explanation: A. These indices are within normal parameters, therefore, the nurse does not need to contact the physician. B. The purpose of turning a client to her left side is to maximize uteroplacental blood flow. Based on the above assessment, there is no indication that blood flow is compromised. C. These interventions are appropriate nursing interventions for late and prolonged decelerations. Following these interventions, the nurse should notify the physician. These indices are within normal parameters, therefore, the nurse does not need to start in 4 and administer O2. D. Variations of 20 bpm above or below the baseline FHR is considered normal. Normal FHRs range from 120,160 bpm. As the fetus moves, the FHR increases, and accelerations often occur in concert with contractions. During the active phase of labor, the frequency of uterine contractions is every 24 minutes, with an appropriate duration of 60 seconds. Question 729. An 18-year-old girl is admitted to the hospital with a depressed skull fracture as a result of a car accident. If the nurse were to observe a rising pulse rate and lowering blood pressure, the nurse would suspect that the client: A. Has a sudden and severe increase in intracranial pressure. B. Has sustained an internal injury in addition to the head injury. C. Is beginning to experience a dangerously high level of anxiety. D. Is having intracranial bleeding. Answer: B. Has sustained an internal injury in addition to the head injury. Explanation: A. Widening pulse pressure, high systolic and low diastolic, with compensatory slowing of pulse rate are late signs of increasing ICP. B. Rising pulse rate and lowering blood pressure are indicative of hypovolemia due to hemorrhage. C. High anxiety, in the absence of hemorrhage, would result in a high pulse rate and a high blood pressure. D. Intracranial bleeding results in increased ICP. A change in level of consciousness is an early sign of increasing ICP, and vital sign changes are late signs of increasing ICP. Question 730. A 28-year-old multigravida has class 2 heart disease. At her prenatal visit at 34 weeks gestation, all of the following observations are made. Which would require intervention? A. Weight gain of 2 kilograms in 4 weeks. B. Blood pressure of 128/78. C. Subjective data, shortness of breath after showering. D. Ankle edema reported present in late afternoon and evenings. Answer: C. Subjective data, shortness of breath after showering. Explanation: A. This is not an excessive weight gain indicative of fluid retention. B. The blood pressure is within normal range. C. Showering should not cause shortness of breath. This could be a sign of cardiac decompensation. D. Dependent ankle edema is normal late in the day among pregnant women. Progressive edema would be a dangerous development. Topic 7. Question Set G. Question 731. Goal setting for a client with Meniere's disease should include which of the following? A. Frequent ambulation. B. Prevention of a fall injury. C. Consumption of 3 meals per day. D. Prevention of infection. Answer: B. Prevention of a fall injury. Explanation: A. Although not contraindicated, initially ambulation may be difficult because of vertigo and is recommended only with assistance. B. Vertigo resulting in balance problems is one of the most common manifestations of Meniere's disease. C. Adequate nutrition is important, but the emphasis in Meniere's disease is not the number of meals per day but a decrease in intake of sodium. D. Infection is not an anticipated problem. Question 732. A 4-year-old has an imaginary playmate, which concerns the mother. The nurse's best response would be: A. I understand your concern and will assist you with a referral. B. Try not to worry because you will just upset your child. C. Just ignore the behavior and it should disappear by age 8. D. This is appropriate behavior for a preschooler and should not be a concern. Answer: D. This is appropriate behavior for a preschooler and should not be a concern. Explanation: A. This is normal for a preschooler, and a referral is not appropriate. B. Telling a parent not to worry is unhelpful. This response does not address the mother's concern. C. This response is incorrect. The behavior is normal and will usually disappear by the time the child enters school. D. This behavior is normal development for a preschooler. Question 733. In planning daily care for a client with multiple sclerosis, the nurse would take into consideration that multiple sclerosis: A. Becomes progressively debilitating without remission. B. Has unpredictable remissions and exacerbations. C. Is rapidly fatal. D. Responds quickly to antimicrobial therapy. Answer: B has unpredictable remissions and exacerbations. Explanation: A. Multiple sclerosis eventually becomes debilitating, but it is characterized by remission of symptoms. B. Remissions and exacerbations are unpredictable with multiple sclerosis. The client experiences progressive dysfunction after each exacerbation episode. C. Multiple sclerosis is usually slowly progressive. D. Multiple sclerosis is an autoimmune disease. Antimicrobial therapy has no effect on its course. Question 734. The nurse is collecting a nutritional history on a 28-year-old female client with iron deficiency anemia and learns that the client likes to eat white chalk. When implementing a teaching plan, the nurse should explain that this practice: A. Will bind calcium and therefore interfere with its metabolism. B. Will cause more premenstrual cramping. C. Interferes with iron absorption because the iron precipitates as an insoluble substance. D. Causes competition at iron receptor sites between iron and vitamin B1. Answer: C. Interferes with iron absorption because the iron precipitates as an insoluble substance. Explanation: A. Eating chalk is not related to calcium and its absorption. B. Poor nutritional habits may result in increased discomfort during premenstrual days, but this is not a primary reason for the client to stop eating chalk. Premenstrual discomfort has not been mentioned. C. Iron is rendered insoluble and is excreted through the gastrointestinal tract. D. There is no competition between the two nutrients. Question 735. Cystic fibrosis is transmitted as an autosomal recessive trait. This means that A. Mothers carry the gene and pass it to their sons. B. Fathers carry the gene and pass it to their daughters. C. Both parents must have the disease for a child to have the disease. D. Both parents must be carriers for a child to have the disease. Answer: D. Both parents must be carriers for a child to have the disease. Explanation: A. Cystic fibrosis is not an X-linked or sex-linked disease. B. The only characteristic on the Y chromosome is the trait for hairy ears. C. Both parents do not need to have the disease but must be carriers. D. If a trait is recessive, 2 genes, one from each parent, are necessary to produce an affected child. Question 736. A 44-year-old client had an emergency cholecystectomy 3 days ago for a ruptured gallbladder. She complains of severe abdominal pain. Assessment reveals abdominal rigidity and distension, increased temperature, and tachycardia. Diagnostic testing reveals an elevated WBC count. The nurse suspects that the client has developed A. Gastritis. B. Evisceration. C. Peritonitis. D. Pulmonary embolism. Answer: C. Peritonitis. Explanation: A. Assessment findings for gastritis would reveal anorexia, nausea and vomiting, epigastric fullness and tenderness, and discomfort. B. Evisceration is the extrusion of abdominal viscera as a result of trauma or sutures failing in a surgical incision. C. Peritonitis, inflammation of the peritoneum, can occur when an abdominal organ, such as the gallbladder, perforates and leaks blood and fluid into the abdominal cavity. This causes infection and irritation. D. Assessment findings of pulmonary embolism would reveal severe substernal chest pain, tachycardia, tachypnea, shortness of breath, anxiety or panic, and wheezing and coughing often accompanied by blood-tinged sputum. Question 737. A couple is experiencing difficulties conceiving a baby. The nurse explains basal body temperature, BBT, by instructing the female client to take her temperature. A. Orally in the morning and at bedtime. B. Only one time during the day as long as it is always at the same time of day. C. Rectally at bedtime. D. As soon as she awakens, prior to any activity. Answer, D. As soon as she awakens, prior to any activity. Explanation, A. Monitoring temperature twice a day predicts the biphasic pattern of ovulation. B. Prediction of ovulation relies on consistency in taking temperature. C. Nightly rectal temperatures are more accurate in predicting ovulation. D. Activity changes the accuracy of basal body temperature and ability to detect the luteinizing hormone surge. Question 738. A client is scheduled for magnetic resonance imaging, MRI, to locate a cerebral lesion. It is important for the nurse to find out if he has A. Allergy to seafood. B. History of seizures. C. Movable metal implant. D. Pin or screw in any bone. Answer, C. Movable metal implant. Explanation, A. Iodine is not used as a contrast medium for MRI. It is important to inquire about allergy to seafood if the client is to have an arteriogram or enhanced computer tomography. B. MRI is safe if seizures are under control. It is more important to inquire about movable metal implants. C. Clients with movable metal implants such as shrapnel or aneurysm clips or clients with permanent pacemakers or implanted pumps can be traumatized during an MRI. D. Non-movable metal prostheses or hardware will not cause trauma during an MRI. Question 739. Stat serum electrolytes ordered for a client in acute renal failure revealed a serum potassium level of 6.4. The physician is immediately notified and orders 50 ml of dextrose and 10 U of regular insulin for push. The nurse administering these drugs knows the rationale for this therapy is to A. Remove the potassium from the body by renin exchange. B. Protect the myocardium from the effects of hypokalemia. C. Promote rapid protein catabolism. D. Drive potassium from the serum back into the cells. Answer, D. Drive potassium from the serum back into the cells. Explanation, A. Sodium polystyrene sulfonate, Kxalate, a cation exchange resin, exchanges sodium ions for potassium ions in the large intestine, reducing the serum potassium. B. Calcium is administered to protect the myocardium from the adverse effects of hyperkalemia. Serum levels reflect hyperkalemia. C. Rapid catabolism releases potassium from the body tissue into the bloodstream. Infection and hyperthermia increase the process of catabolism. D. The administration of dextrose and regular insulin forces potassium back into the cells, decreasing the potassium in the serum. Question 740. A measurable outcome criterion in the nursing care of an adolescent with anorexia nervosa would be A. Accepting her present body image. B. Verbalizing realistic feelings about her body. C. Having an improved perception of her body image. D. Exhibiting increased self-esteem. Answer, B. Verbalizing realistic feelings about her body. Explanation, A. This outcome criterion is inadequate because the term accepts is not directly measurable. B. This outcome criterion is directly measurable because specific goal-related verbalizations can be heard and verified by the nurse. C. Improved perception of body image is not directly measurable and is therefore open to many interpretations. D. Although long-term goals for the anorexic client should focus on increased self-esteem, this outcome criterion, as stated, does not include specific indicators or behaviors for which to observe. Question 741. A pregnant client is having a non-stress test, NST. It is noted that the fetal heartbeat rises 20 bpm, lasting 20 seconds, every time the fetus moves. The nurse explains that A. The test is inconclusive and should be repeated. B. Further testing is needed. C. The test is normal and the fetus is reacting appropriately. D. The fetus is distressed. Answer, C. The test is normal and the fetus is reacting appropriately. Explanation, A. The test results were normal, so there would be no need to repeat to determine results. B. There are no data to indicate further tests are needed, because the result of the NST was normal. C. An NST is reported as reactive if there are 2 to 3 increases in the fetal heart rate of 15 bpm, lasting at least 15 seconds during a 15-minute period. D. The NST results were normal, so there was no fetal distress. Question 742. On the third postpartum day, the nurse would expect the lochia to be A. Rubra, B. serosa, C. alba, D. scant. Answer, A. rubra. Explanation, A. This discharge occurs from delivery through the third day. There is dark red blood, placental debris, and clots. B. This discharge occurs from days 410. The lochia is brownish, serous, and thin. C. This discharge occurs from day 10 through the 6th week. The lochia is yellowish-white. D. This is not a classification of lochia but relates to the amount of discharge. Question 743. The following nursing diagnosis is written for a comatose client with cirrhosis of the liver and secondary splenomegaly, high risk for injury, increased susceptibility to bleeding related to A. Increased absorption of vitamin K, B. Thrombocytopenia due to hypersplenism, C. Diminished function of the Kupffer cells, D. Increased synthesis of the clotting factors. Answer, B. Thrombocytopenia due to hypersplenism. Explanation, A. There is a decreased absorption of vitamin K with cirrhosis of the liver. This decrease impairs blood coagulation and the formation of prothrombin. B. Thrombocytopenia, an increased destruction of platelets, occurs secondary to hypersplenism. C. A diminished function of the Kupffer cells occurs with cirrhosis of the liver, causing the client to become more susceptible to infections. D. A decrease in the synthesis of fibrinogen and clotting factors 7, 9, and X occurs with cirrhosis of the liver and increases the susceptibility to bleeding. Question 744. When assessing a client, the nurse notes the typical skin rash seen with systemic lupus erythematosus. Which of the following descriptions correctly describes this rash? A. Small round or oval reddish-brown macules scattered over the entire body. B. Scattered clusters of macules, papules, and vesicles over the body. C. Bright red appearance of the palmar surface of the hands. D. Reddened butterfly-shaped rash over the cheeks and nose. Answer, D. Reddened butterfly-shaped rash over the cheeks and nose. Explanation, A. The appearance of small, round or oval reddish-brown macules scattered over the entire body is characteristic of rubeola. B. The appearance of scattered clusters of macules, papules, and vesicles throughout the body is characteristic of chickenpox. C. Palmar redness is seen in clients with cirrhosis of the liver. D. The characteristic butterfly rash over the cheek and nose and into the scalp is seen with systemic lupus erythematosus. Question 745. A 23-year-old female client is brought to the emergency room by her roommate for repeatedly making superficial cuts on her wrists and experiencing wide mood swings. She is very angry and hostile. Her medical diagnosis is adjustment disorder versus borderline personality disorder. The client comments to the nurse, "Nobody in here seems to really care about the clients. I thought nurses cared about people." The client is exhibiting the ego defense mechanism. A. Reaction formation. B. Rationalization. C. Splitting. D. Sublimation. Answer, C. Splitting. Explanation: A. Reaction formation is the development and demonstration of attitudes and/or behaviors opposite to what an individual actually feels. The client's comment does reveal her anger and hostility. B. Rationalization, another ego defense mechanism, is offered socially acceptable or seemingly logical explanation to justify one's feelings, behaviors, or motives. The client's comment does not reflect rationalization. C. Splitting, the viewing of people or situations as either all good or all bad, is frequently used by persons experiencing a disruption in self-concept. This ego defense mechanism is reflective of the individual's inability to integrate the positive and negative aspects of self. D. Sublimation, the channeling of socially unacceptable impulses and behaviors into more acceptable patterns of behavior, is another ego defense mechanism. The client's comment reveals that she is not engaging in sublimation. Question 746. A pregnant client is having a non-stress test, NST. It is noted that the fetal heartbeat rises 20 bpm, lasting 20 seconds, every time the fetus moves. The nurse explains that A. The test is inconclusive and should be repeated. B. Further testing is needed. C. The test is normal and the fetus is reacting appropriately. D. The fetus is distressed. Answer: C. The test is normal and the fetus is reacting appropriately. Explanation: A. The test results were normal, so there would be no need to repeat to determine results. B. There are no data to indicate further tests are needed, because the result of the NST was normal. C. An NST is reported as reactive if there are 2 to 3 increases in the fetal heart rate of 15 bpm, lasting at least 15 seconds during a 15-minute period. D. The NST results were normal, so there was no fetal distress. Question 747. On the third postpartum day, the nurse would expect the lochia to be A. Rubra, B. serosa, C. alba, D. scant. Answer: A. rubra. Explanation: A. This discharge occurs from delivery through the third day. There is dark red blood, placental debris, and clots. B. This discharge occurs from days 410. The lochia is brownish, serous, and thin. C. This discharge occurs from day 10 through the 6th week. The lochia is yellowish-white. D. This is not a classification of lochia but relates to the amount of discharge. Question 748. The following nursing diagnosis is written for a comatose client with cirrhosis of the liver and secondary splenomegaly, high risk for injury, increased susceptibility to bleeding related to A. Increased absorption of vitamin K. B. Thrombocytopenia due to hypersplenism. C. Diminished function of the Kupffer cells. D. Increased synthesis of the clotting factors. Answer: B. Thrombocytopenia due to hypersplenism. Explanation: A. There is a decreased absorption of vitamin K with cirrhosis of the liver. This decrease impairs blood coagulation and the formation of prothrombin. B. Thrombocytopenia, an increased destruction of platelets, occurs secondary to hypersplenism. C. A diminished function of the Kupffer cells occurs with cirrhosis of the liver, causing the client to become more susceptible to infections. D. A decrease in the synthesis of fibrinogen and clotting factors 7, 9, and X occurs with cirrhosis of the liver and increases the susceptibility to bleeding. Question 749. When assessing a client, the nurse notes the typical skin rash seen with systemic lupus erythematosus. Which of the following descriptions correctly describes this rash? A. Small round or oval reddish-brown macules scattered over the entire body. B. Scattered clusters of macules, papules, and vesicles over the body. C. Bright red appearance of the palmar surface of the hands. D. Reddened butterfly-shaped rash over the cheeks and nose. Answer, D. Reddened butterfly-shaped rash over the cheeks and nose. Explanation, A. The appearance of small, round or oval reddish-brown macules scattered over the entire body is characteristic of rubeola. B. The appearance of scattered clusters of macules, papules, and vesicles throughout the body is characteristic of chickenpox. C. Palmar redness is seen in clients with cirrhosis of the liver. D. The characteristic butterfly rash over the cheek and nose and into the scalp is seen with systemic lupus erythematosus. Question 750. A 23-year-old female client is brought to the emergency room by her roommate for repeatedly making superficial cuts on her wrists and experiencing wide mood swings. She is very angry and hostile. Her medical diagnosis is adjustment disorder versus borderline personality disorder. The client comments to the nurse, "Nobody in here seems to really care about the clients. I thought nurses cared about people." The client is exhibiting the ego defense mechanism. A. Reaction formation. B. Rationalization. C. Splitting. D. Sublimation. Answer, C. Splitting. Explanation, A. Reaction formation is the development and demonstration of attitudes and/or behaviors opposite to what an individual actually feels. The client's comment does reveal her anger and hostility. B. Rationalization, another ego defense mechanism, is offered socially acceptable or seemingly logical explanation to justify one's feelings, behaviors, or motives. The client's comment does not reflect rationalization. C. Splitting, the viewing of people or situations as either all good or all bad, is frequently used by persons experiencing a disruption in self-concept. This ego defense mechanism is reflective of the individual's inability to integrate the positive and negative aspects of self. D. Sublimation, the channeling of socially unacceptable impulses and behaviors into more acceptable patterns of behavior, is another ego defense mechanism. The client's comment reveals that she is not engaging in sublimation. Welcome to Part 10 of our 862-question NCLEX-RN 2026 practice series. In this video, you'll complete questions 651 to 750, featuring NCLEX-style practice questions with detailed explanations to strengthen your clinical judgment, nursing knowledge, and exam confidence. Books like, subscribe, and turn on notifications to follow the complete 862-question NCLEX-RN 2026 series and keep preparing for NCLEX-RN success.